It's not a time that we want to go and start doing high vaginal swab. We might not want to go to that investigation. But once that woman come as a normal, we want to do high vaginal swab to see the organism. Then we do culture. We know the particular organism that will be able to kill this. But usually we don't bother that in early stage of pregnancy. Number one is that during that process of trying to collect the high cervical swab, you can induce premature contraction, making that person to go into miscarriage. We avoid it. Sometimes you see if it's something the woman can live with, let her be. And even if you do culture sensitivity, the culture might end up telling you the drug to use, and that drug will not be safe in the early phase of pregnancy. So most time we let it be. Now, the way we treat malaria in the first trimester, and why are we so concerned about this first trimester? In that first trimester is when most issue occur. It is actually the age of organogenesis. That is the stage when most organs are being formed. That is when the sequences are being laid down. The foundation of all organs will be there. And we say that the first organ to start functioning in the human body is what? The heart. That is the first organ to start functioning. And this organ start functioning at 3 weeks. 21 days from conception, the organ has started functioning. I don't know if you understand. Now, mind you that if a woman is supposed to see her menses data and she didn't see it, if by commission or by omission she is pregnant, mind you that she's already 2 weeks pregnant, as at that time she is supposed to see her menses. So 1 week later, the heart will start functioning. And why it is very dangerous is that at that time, most women are taking anything they see, thinking that the menses is just delaying. And you see some of them will be busy taking alcohol, and they are busy telling you na menses kagapota. Before you know it, by the time they actually came to the conclusion that this is pregnancy, the heart of the baby has started beating. But that time you might not be able to find it through the transvaginal ultrasound. You can go to ultrasound, they will say they didn't see the fetal heart. It doesn't mean that all miscarriage. Sometimes they will tell you to come back in 2 weeks or so. If you go back that time, you will see it. But the heart of the baby, the heartbeat of the baby is there. Why are we talking about first trimester? Is the age of what? Organogenesis, development of the organ. So everything is already there. What will form the heart is there. That first week, second week, whatever will form the head